Thank you so much. It's such a pleasure to be here with you today, and I've so enjoyed the whole festival, and I want to thank Carol and colleagues at Time of Your Life for all their fantastic support and the original invite to join you. So today I'm going to just give you a little bit of an overview, tell you a little bit about what we're doing in the UK, but from our perspective, what's so important about this is coming together and exchanging great ideas and what's working in different ways. There is so much that we can learn from each other, exchange great ideas, and that's fundamentally what this is about. So I'm going to talk for a short while, and then there'll be a little chance for us to, in smaller groups, just say what we feel are some of the priorities, perhaps some of the gaps, and then a little bit of a feedback session together. Just by way of introduction, I am the Deputy Director of the UK National Innovation Centre for Ageing, and that was originally set up by UK government to really help to bring forward very practical, affordable innovation that's needed to support all aspects of healthy ageing, but perhaps especially for people with dementia. There is so much out there. There's so many wonderful ideas, amazing innovation, some really, really creative technologies but we must make sure that they're very accessible to families, that they're affordable, and that people can find them. So a big part of this is about grounding everything that we do in the experience of families. I do wear several hats, like I'm sure many of you do, but my other hat is that I'm also a trustee of the Lewy Body Society internationally, and also I run something with Dame Professor Louise Robinson called the International Dementia Hub, which is about bringing forward international innovation on dementia. So very much about where is all of that imagination and how can we together bring it forward and ground everything we do in the lived experience of families with dementia. So a lot of the time through my talk today, I'll be bringing forward the views and perspectives of some of the surveys that we've done, grounding everything in the people who really matter, the people who are living every day with dementia. So in terms of, just very, very briefly about us, we are the UK National Innovation Centre, set up by UK government, and embedded within it, we have an organisation called VOICE. VOICE stands for Valuing Our Experience, and it's thousands of members of the public, people like yourselves from all walks of life and all backgrounds, who help us contribute their wisdom, their experience, ideas, insights, thousands of people across Asia, across Europe, United States, coming together to say, this is what matters, this is what we care about, this is our priority. So we very much ground everything that we do in those views. Just a little bit in terms of the background, in terms of the size of the challenge of dementia. We know that there is amazing kind of innovation coming forward all the time. There is just astonishing discoveries. Almost every day you pick up the paper and there's a new discovery, so a new sort of scientific inquiries come forward, data, there's so much that's possible. But we've got to make sure that we match that amazing data experience alongside that lived experience. Perhaps the biggest asset we have is us as people. We have so much creativity and knowledge, and that's going to be what really powers the difference in terms of making that step change to better care, better quality of life for the millions of people across the world who are living with dementia. Currently, there's about 55 million people experiencing dementia across the globe. That is likely to be a massive underestimate because we know that in many, many regions, diagnosis is very patchy, sometimes non-existent. And so we know that this is a global challenge of huge proportions. Again, if we get it right for people with dementia, if we get care right for people with dementia, we get care right for a lot of other groups as well. So it's so important that we have a spotlight on dementia and in really, really understanding what matters. 60% of people who live with dementia are currently in low and middle income countries. And so this is not just a challenge for UK, for Singapore, and for kind of places like US and Canada. This affects literally every region. And again, it's really important that we work together to make sure that any solution is very culturally appropriate, it's appropriate for different care systems, and that we can learn from different systems about what matters in terms of care. Again, just a shout out for some of the organisations like Alzheimer's Disease International, who are doing fantastic work in bringing forward a lot of these innovations. They really do make a massive difference. Just very, very quickly, for those of you who actually work in dementia, I'm sure you will know this very well, but just for those of us who are kind of family carers, etc., it is important to remember that dementia is an umbrella term. It's an umbrella term for scores of different types of condition. There is everything from Alzheimer's disease, which is the most common dementia. I mentioned that I was a trustee of the Lewy Body Society, and Lewy Body is perhaps the second most common dementia, likely to be massively underdiagnosed, and it's particularly difficult for carers. It's characterised by a lot of agitation, very, very aggressive behaviour, and so it's particularly challenging for family carers to deal with. But then, of course, there's vascular dementia, which is kind of, arising often from strokes and so on. Parkinson's disease also causes dementia. So as we get, on in our dementia journey, it's really important to get an accurate diagnosis of what type of dementia that our family, that we are experiencing, because that really matters in terms of navigating to the right care and the right support. So the importance of timely and early diagnosis just cannot be underestimated in terms of understanding dementia. Again, there's so many misdiagnoses, so that's something that in the UK, and I know in Singapore, it really is being addressed to help people to get that. And again, dementia is one of those areas that it causes huge disability and dependency across the world, and it's very, very costly, which is why many, many governments are looking to invest in dementia care and support, look at in terms of prevention of dementia as well. Just to give you an idea of the cost. Globally, we reckon it's minimum of 1.3 trillion every year in terms of the attributable cost of dementia. And it's really a personal cost as well. On average, carers can be providing 12 hours of one-to-one care every day. And globally as well, it disproportionately affects women, both directly and indirectly, in that women do provide most of the care, and often 70% of care hours for people with dementia are provided by women. In the UK, we have a huge cost of dementia, 4.5 billion in social care as a minimum, 11.6 billion pounds in unpaid informal care, 4.3 billion in terms of healthcare, and then 5.8 billion spent on individual social care. So it is hugely costly in terms of, the provision of health and social care, but perhaps the biggest cost is in terms of people's health and well-being, in terms of the strain that actually caring for families with dementia can actually have. So again, hugely important alongside dementia diagnosis that we also are investing in really world-class care and support and services, products and services technology that can really, really help people in their daily lives. And this is what we kind of use as our kind of roadmap for living well with dementia. Everything from really looking after people's brain health in the early stages, to actually making sure that across that journey we're able to look at everything from the prevention of dementia, early diagnosis, identifying early memory problems, and then actually in terms of that diagnosis and support. Then a huge amount of activity, which I'll talk a little bit later on, in terms of how to live well with dementia. It is perfectly possible, with the right health and support, of course, to have a really good quality of life with dementia. But we have to keep our foot on the pedal of making sure that we're always improving those services, improving that care, and actually bringing forward, what is really going to work and from everywhere else. And everything that we do, as I said at the start, is through the lens of the carer. We feel as if you look at dementia through the lens of the carer, that person, it could be someone's mum, dad, it could be someone's sister, brother, husband, wife, but actually looking after the carers and caring for the carer is really where we take our innovation steer from, and really supporting those people to be able to care well. The nature of dementia means that it can be very, very challenging to care. I don't know if a quick show of hands in the room, apologies to those online, how many people are carers of people with dementia? A fair few of us. I would include myself in that. And so, again, you know firsthand what it's like. But very much about how we can actually listen to those carers' perspective and develop the products and services to support. Very quickly, I'm just going to give you a bit of an overview in terms of the UK policy perspective. And part of the joy of coming to Singapore is that I can also learn from Singapore colleagues about what is working here. And again, that exchange where we can take the best of the best, if you like, and translate that into care and support services wherever we are. The UK, about 10 years ago now, I was involved in setting and developing some of the first dementia strategies for dementia. Our Prime Minister at the time, a man called David Cameron, had the PM's challenge on dementia, and that was transformational for us. Until that point, dementia had been the poor relation of research and care. For every £10 spent on other conditions, £1 was spent on dementia. And while it's important to also spend on those other conditions, it just showed that dementia had had years, decades of underinvestment. And that was a really transformational time where the spotlight was rightly put on the needs and challenges of dementia. And actually from that followed a huge push for investment in research for people with dementia, to understand the causes, to understand treatments that could be brought through. And most importantly as well, for care, to raise awareness amongst the public and health professionals about the importance of dementia, and to make sure that the services and the integrated care services from that followed. A big push from that kind of PM's challenge and that early strategy meant that we were able, from the UK perspective, to really think across that dementia journey. And I'm just going to kind of summarise some of the real priorities that we have been looking at. The first of all, as in Singapore, is this really big push to invest in lifelong brain health and prevention. The early strategy in the UK, and I'm sure Singapore has similar work, was actually called Look After Your Heart, Look After Your Head. And that was really important in shifting public perceptions to understand that actually a big part of prevention of dementia is to invest in nutrition, in lifestyle, in exercise, really almost the same as cardiovascular disease, to keep people fit and healthy as long as possible. And that was going to be a cornerstone, if you like, of the brain health strategy. Of course, technological advancements played a huge part in this, and there was also a huge amount of work that was invested in, drawing again on colleagues in Japan and elsewhere, looking at kind of brain training, cognitive exercises, and virtual reality platforms, often in gamified format, to really kind of look at how we could enhance memory, attention, and problem-solving skills. Now, in the early stages, frankly, the evaluation of these was quite patchy, but we felt they had great promise, and continue to be interested in seeing them, because there's no doubt that all of the evidence around healthy aging suggests that actually it's social connections that keep us the healthiest, and actually meeting up with friends and family, learning new skills, lifelong learning, developing new hobbies and interests, that's what keeps us connected and healthy, and that also can have a protective impact on some dementias. And so very, very important to kind of look. I've put on the screen here some of the really kind of more advanced ones in terms of some of the virtual reality that is showing promise, but this can also be very, very basic in terms of kind of music, some fantastic kind of brain health apps in terms of music health and so on, looking at dancing, looking at kind of keeping moving and just enjoying, living life kind of thing. But then also the reminiscence theory, there's memory support, all of this we feel really matters. And so a big push to investing in that brain health and in the prevention, which has got to be important to protect us all as much as we can do from developing dementia, or some types of dementia. Again, we have invested, and it's paying dividends, I think, in investing in this early and timely diagnosis. Cutting-edge dementia diagnosis now leverages a lot of digital technology. There's been huge advances over the last 5-10 years in biological markers so that we can really understand kind of what's happening. And, of course, the advances in AI and data analytics and machine learning and so on has really meant a step change in understanding what's happening in someone's brain. Great advances in scanning, for example, which are now readily accessible to everybody. And these kind of innovative approaches have really helped us to give a much more accurate detection of cognitive decline, and then that that opportunity to put in some transforming patient care and treatment strategies. A big challenge for us in the UK, there's over 80 million, 1 million people with dementia and rising, is of course that equal access of a good diagnosis for everyone, and that kind of inequalities in terms of treatments remains a big challenge, but something that we strongly have the focus on. Why is early diagnosis so important? Because it really gives you access to early treatment. For many, many years, there was very little in terms of treatments for people with dementia, but thanks to global investment, and the UK government has massively invested in research and development of all aspects of this, alongside, I know, colleagues in Singapore. It means that innovative approaches to early dementia treatment, including personalised medicine, groundbreaking therapies, and perhaps, some really interesting areas such as repurposed drugs which were originally developed for diabetes, showing real promise to treat dementia. And then researchers and clinicians, doctors, are able to really tailor those treatments based on kind of, almost individual genetic profiles. And then there's work exploring immunotherapy drugs, which have shown, again, great promise. And so a lot of this work still in early stages, but you can see the excitement, the possibility. And I think that hope, that optimism is so important, that this is something that we can together defeat. Investing in science, investing in great research means that we can really sort of accelerate and catalyse these treatments that ultimately we can have hope that perhaps the brain is the last frontier to understand. It's perhaps the most complicated bit of our bodies, but wow, when we put our minds together globally, connecting all of that fantastic science, yes, a cure is a real possibility, and I think that's really exciting. And then, of course, the interventions from a treatment and a drug point of view are really complemented by the non-drug approaches, perhaps as important in terms of looking at cognitive stimulation, looking at lifestyle modifications, again, back to exercise, how we can actually, connect in our communities, keep good nutrition, keep very, active in terms of lifestyle, and then really kind of enhancing quality of life and potentially altering the progression of dementia, certainly in those early stages. So, the early stage treatment's really, really important. This, for me, has been a fundamental part of the dementia journey in terms of really investing in dementia-friendly environments. We've had a long focus on dementia-friendly environments in the UK. Stirling University in Scotland pioneered this about 35 years ago with a lady called Mary Murdoch, where we've been looking at design of dementia-friendly environments, home adaptations, how to really build communities, our cities, our homes to be dementia-friendly. And I know Emmy Kota here in Singapore is doing fantastic work on this as well. And designing dementia-friendly environments is a rapidly evolving field. And again, it's creating very safe, comfortable and supportive spaces that really do meet and support the unique cognitive and physical needs of many more people with dementia. We also, in the UK, from the National Innovation Centre for Ageing, we have a programme called Cities of Healthy Longevity. Because actually, if you think about it, you break it down into, there's two major agendas for all of us, which is healthy people and healthy planet. And all of this policy that is working separately, actually, if we just corralled it together, how much more efficient and effective it would be. So that we actually, looked at how we could make our cities, our our environments just the best for people to thrive and flourish, regardless of who they are, what background they are, and including, of course, people with dementia. Some of the early work that we've had on dementia environments was quite simple. It looked at kind of the signage, for example, of train stations, looking at kind of navigating around the community, really important. It looked at things like how to optimize lighting, given that quite a lot of people with Lewy body dementia especially have difficulty with contrast. And so some of that work was very, very important. Again, even choosing fabric and color can make a big difference to people with dementia. And so I know in Singapore, but also in the UK, a lot of our hospitals didn't, for example, have hospital curtains with patterns on, because again, for somebody with Lewy body dementia, that could actually look as a hallucination and really trigger quite problematic behaviour. So actually what on the surface can seem very simple, cumulatively can actually make a radical impact in terms of just making that difference to improve the quality of life for people living with dementia. So dementia design really, really matters. Everything from colour schemes and flooring to minimise confusion, but then also to prevent falls, for example. So practical guidance like that really, really matters. And from the UK Innovation Centre, and again, we're hoping to work with colleagues in Singapore on this, we're looking to update those national and international guidelines, because all the time there is new evidence coming forward about colour, about smell, about the environment. And again, we're coming from the perspective of that if the evidence is available, we want people to know so that they have the best opportunity of adapting their homes, their communities, to have the best possible experience. And then again, I've put on the screen some of the latest innovations which kind of seamlessly integrate all this new cutting-edge technology into people's environments. And so now coming forward, there's all sorts of enhanced monitoring and support systems which can again really help people live well with dementia. So, for example, you'll know from Alzheimer's disease, one of the big issues is that people can wander, they can become very disorientated, and perhaps also wake up at night. So they're not sleeping terribly well, which is exhausting for carers, and also very, very worrying if people kind of, are lost. The advances in wearable technology is just really exciting now, and it can just be done through a simple smartwatch and an iPhone. Simple technologies, but can make such a difference to people with dementia and their families. And then again, I mentioned the PM's challenge on dementia in the UK. And again, the UK pioneered something called Dementia Friends and dementia-friendly communities. And Dementia Friends was not an insignificant initiative, and it set out to raise awareness amongst general public about dementia, because so much stigma, so much misunderstandings and myths and assumptions about people with dementia, and really trying to dispel those myths so that, in your street, in your neighbourhood, if somebody was experiencing dementia, that you knew how to deal with that. And again, local businesses, dentists, opticians, chiropodists, shopkeepers, business owners, it's so important that they also understand a little bit more about dementia. Our police forces, our fire services, our ambulance services, and of course our health professionals. So the Dementia Friends initiative was the cornerstone of making sure that training and advice was available to scores of people. 3 million people became dementia friends up to about 2020, and the numbers rising all the time. So that's a really important policy initiative from the Alzheimer's Society, so that more people will just be understanding and a little bit more caring of the experience of dementia. The other cornerstone for us is, as I said a number of times, caring for carers. When we actually surveyed our voice membership in terms of dementia, it was about this time last year, around about 82% of people living with dementia said that respite care was really, really important for them because they just didn't have a break. But interestingly, of those people surveyed, the same 62% said that they had immense problems when the person came back from respite care. And this is an example whereby it's so important, as we were discussing earlier, to listen to the carers, but to really go deep to understand their specific problem. Because that was an example of whereby the carer said to us that respite care was important, but the way that that respite care was organised and delivered and the support that they needed was really, really, important to understand, because they had this period when they had just settled into having a break, and all of a sudden the person that they were caring for returned home, and actually they just didn't get the break that they intended. So from that, we've been able to rearrange some of the respite care. In the UK, respite care fell down the policy agenda. It wasn't being funded enough. And so again, through this work, we've been able to raise the profile of respite care and also look for different ways to provide it. I mentioned at the start that we're part of the Innovation Centre for Ageing, and a big part of this is that the leisure industry and the entertainment industry can also step in and support by providing a different type of respite care. So, for example, just because you have dementia, it doesn't mean to say you don't want to go on holiday and actually have a change of scene. And so, again, we've seen some fantastic companies come forward, helping to support people to go on holiday, have new experiences, still live life to the full, but they need to be dementia-friendly services and support. And so that's been a really, really important place for development in terms of caring for the carers. And we've seen this, and again in Singapore I see some fantastic work, but the innovations in caregiving support, it's just rapidly evolving, which is really exactly what's needed and really, really important. And we're seeing massive advances in terms of digital platforms providing kind of very personalised support. We're seeing a lot of kind of artificial intelligence being able to help with predictive insights, for example. So a couple of years ago, we put communication for carers as our number one priority, because on a very human level, what dementia does is it robs you of the ability to have a simple conversation, a simple chat. What do you want for dinner tonight? What do you want to do? What are you thinking? What are you feeling? And the very nature of dementia, because of the difficulty with word finding and memory problems, and then being able to articulate that, meant that couples who had been married for 40 years, mums and daughters, mums and sons, fathers and sons, all of a sudden just couldn't have a simple conversation. So we looked to say, can technology help with that? And this is where by focusing our universities, all of that talent and imagination, harnessing the wisdom and the experience of people who've been through the experience of dementia, that's when we can bring it all together and make sure that we're focusing our resource, our assets on innovations that we know that families need and want. And so the innovations are coming through in order to kind of really, really help carers to communicate. There's all sorts of ways through wearables, for example, that somebody can predict when the person might be getting a little bit stressed, a little bit agitated, before that becomes, a problem in terms of behaviour. And that's hugely helpful to professional carers in care settings, but it's also really helpful to family carers as well. And again, to hear from you in terms of what your priorities and your imagination. I guarantee if we went round the room, people would have so much knowledge and ideas and experience. And what we do in Voice and Lika is we simply provide a platform to harness that, so that if you've got something to say and share, we want to hear it, and then we want to kind of work with others to be able to bring forward something that's going to make a difference, if not to you short term, but to others in the future. And again, it's something that we are all working on very, very closely together. So I think some of the trends in wearable technologies, I could get quite geeky. I think it's really exciting because I can see how it helps people. But I think, again, as I said at the start, what we've got to make sure is that all of this fantastic technology is accessible and it is affordable for people. But there is no reason why that can't be the case. And really, really exciting in terms of some of the virtual reality. and some of the actual work that is particularly focused on empathy. The most important thing when you have dementia is that people empathise with you and they really understand you. So again, looking at that. And another area that we've also been looking at is the UK. Large parts of our colleagues in Canada and across the world live in very rural areas. And so while in Singapore you've got kind of the challenges of urban environments, we also need to make sure that we're supporting people who might live remote from a lot of kind of care services. So that's going to be really, really important for us in terms of managing that. And then again, final part on care for carers is also remembering that a lot of people who are caring are also working. They're also looking after other family members. And so we've got to look after their health and well-being as well. This is where policy often gets very kind of muddled. And again, what I said about longevity cities, where we're trying to bring a lot of different policy agendas together, is that on the one hand, you might say to women to continue to work longer because, financially you've got to be, fit for later life. But then if you're also having to take time out to care, how challenging is that? So how can we provide policy frameworks that really look after people at all stages of life, and make sure again that if somebody is providing care in the UK, we found that 45% of women left the workforce before the age of 60 to provide care, informal care, but then did not go back to work. It wasn't that they didn't want to go back to work sometimes, but often they were not able to, the opportunities weren't there, and also high levels of depression and anxiety. When someone has been through that experience of caring for dementia, we've really got to look after them, because it can be several years afterwards that the impact of the enormity of what they've been through hits. And so again, looking after people's mental health and well-being as carers is an absolute priority. Just a couple of, on long-term care. And for me, this is a really, really interesting area. So innovations in long-term care, which might include hospice care as well for dementia, and enhancing kind of the support through various tech solutions in the home have been really important. And again, thinking of some of the technology, there's all sorts of kind of personalised experiences that we can bring through now through virtual reality, which might prompt a happy memory, for example, of a holiday or something like that. And again, I think we need more research in this area. And if you went searching, there are literally hundreds of apps on your phone which can kind of give advice and guidance on kind of daily routines and so on. There's a lot of companion devices which are providing emotional support. I actually, when I was a rookie PhD student, actually worked on the Paro robot. So that's bringing back a lot of memories for me. But again, a lot of evidence around pets and the benefits of kind of, looking after dogs, cats, etc. All sorts of a range of issues about, what works well in long-term care. And again, living labs test solutions in real-world settings to kind of ensure these really practical benefits. So there's a huge amount of activity in this area. Again, a lot of the emerging trends that are coming through in terms of looking at kind of remote care. Again, if you think globally, here in Singapore as well, that, we're not all near our mums and dads, we're not all near family members who might be experiencing dementia. So how can we support remote care becomes a really important area. But again, what we found particularly interesting quite recently, again in another Voice survey, was that all of the policy in the UK is directed around reducing the number of people in nursing homes and nursing care and providing care in people's own home. It looks like it's very contrary to what a lot of carers are asking for, which provides a real policy dilemma and a real funding dilemma. This is a quote from Ben, a Voice member, and he said, "I want nursing care. It might not be the government's wish, but care at home is not my wish." And this reflects not his wish as such. It was the fact under such strain, caring for his wife of 40 years who had advanced dementia, and really feeling that there was not the care and support in his home to be able to deal with that. Often dealing with incontinence, which is a real issue. And so again, we have to be very careful to make sure that the policy, which might be in very well-meaning policy, looking at reduced costs, etc. But we also need to make sure that that policy is working for carers and for people living with dementia. Again, somebody in terms of the voice member said, I want to provide care at home, but I do not feel I'm equipped to provide it. I feel that this is undermining our 42 happy, wonderful years together. I do not feel I have the care and support to care for my husband with dementia. And so again, while we are making advances, we have always got to sense check, is this working for different people, and to make sure that there is choice across the system, because what is right for one family might not be right for another. And I think, again, it is no right or wrong here. It's about making sure that at different stages of the journey of dementia, at the different stages of people's lives, depending on their own circumstances and context, there is what is right for them, and that we have just that bit of choice available for people. So that's kind of a quick, very flick through some of the key issues that we're focusing on. And I just, wanted to give you a little bit of a focus now on memory clinics, which is, from our perspective in the UK, have been a bit of a cornerstone, if you like, of our policy provision. I'll explain a little bit about what memory clinics are, but where they first got developed around about 40 years ago in the UK. They're a very long-standing model, and they've been scaled significantly following the national dementia strategies that I've mentioned from David Cameron onwards. They were originally very much in secondary care, so in hospitals, but very much now a focus on primary care from our general practitioners and based in the community. But what memory clinics fundamentally are is responding to what carers, people with dementia, and professional carers wanted, which is about integration of a lot of complex different care services and really, really helping to coordinate that. So that's really what memory services are intending to do, to join up primary care and secondary care with voluntary and community services. So a very, very important part of UK policy. So what is a memory clinic and how does it work? Well, I'm sure you have memory clinics in Singapore too, but from the UK, they're very much about they're kind of a specialist health facility that focuses on diagnosing, treating and managing kind of memory loss and some of the diseases that underpin them in adults. And so they're really about kind of evaluating someone's memory. It might be to assess dementia, give that accurate diagnosis that I mentioned earlier, and then really put in place the support and care that's personalised and tailored to that person, that addresses, it could be the physical problems that someone's having, it could be the cognitive problems, the memory problems that someone's having, but mostly they deal with people with dementia, but they could also be someone who's had a stroke, Parkinson's, depression, and so on, so they can be quite wide-ranging. Usually people are referred to a memory clinic by their GP, their general practitioner, which is our family doctor, if you like, but also can be referred from hospital settings or from community services. And it actually involves a very, very wide range of health professionals. So could have psychologists, social workers, people who are particularly focused on rehabilitation, for example. And then, as I mentioned earlier, even links to other people like dentists, opticians, chiropodists, whatever that person needs. The idea is that the memory service can really, help to coordinate a very comprehensive care plan with an individually treatment plan that's developed by doctors working in collaboration. They also have a big role in education, so actually directing people to education about dementia, to raise awareness and so on, the guidance, and then also in terms of support groups, in terms of primary care. They're absolutely essential in helping people to understand what's available and to be able to access it. So again, it's not all doom. It's about making sure that people have that opportunity to live the best possible life with dementia, but also to make sure that they get that proper diagnosis and that people can really effectively manage the symptoms and live life, to the full as is possible. They're a hugely important part of looking at research as well. So a lot of our memory clinics, people are very active in research, really important in terms of bringing forward the treatments. As I said, a lot of new treatments that need to be properly evaluated, and memory clinics have got a really important role in that. So the policy aim of the memory clinics, and also I think the reality, and it's certainly my personal experience, is that they can really reduce the burden of cognitive decline on kind of people living with it, families and society more generally, I guess, in terms of the community. But then, they really can, give that access to the right treatment at the right time. So that's been a really, really important part. And from the carers that we surveyed, they all said that, the memory clinic had been a real lifeline, because you had this hub, this central point where you had someone who understood what you were experiencing and then could navigate onto to the right support and guidance. It's really important in terms of understanding memory clinics that they have evolved. I mean, they are so much better than they were, but of course everything is rarely perfect. And we wanted in the UK to have world-class dementia services, to really invest in them, and so memory clinics have received a huge amount of investment in terms of hosting research studies, looking at kind of a wide range of being a test bed for innovation. A lot of educational resources have been developed through them so that we can help carers to understand what strategies work. A lot of very practical home adaptations, as I mentioned earlier, in terms of assistive technology, suggestions of coping strategies. All of this comes under a memory clinic remit, and they are hugely important in terms of helping to navigate to the right care and guidance. And kind of this gives you an idea of the complexity that they're dealing with. I think across the board in healthy ageing and ageing support, we've kind of evolved our services. They've not really been designed, so we've kind of bolted a bit on as it becomes available. And so you can end up with a bit of a mishmash of services. And actually what the memory clinic model has tried to do is to actually bring all of that complexity together. So there's a one-stop shop where people can actually be able to navigate from primary care to social care services, look at that patient care involvement, research, access to kind of some professions allied to medicine, for example, as well. So really about trying to bring forward what carers ultimately and families say they want, which is much more collaboration between various specialists, everyone from hospital doctors, nurses, social workers, researchers, even sleep experts, for example, some very sort of specific areas. Again, providing that kind of holistic care and support to patients and families. Linking very closely with community-based services and voluntary sector organisations. In the UK, for example, we have major charities like the Alzheimer's Society who provide a huge amount of support and guidance for people living with dementia, alongside kind of research organisations like Dementia UK. And again, the vast majority of people with dementia are living at home in the community. And so being able to really proactively work with specific community groups is really, really important. And of course, like Singapore, the UK is a huge multicultural society, and so it's really important that memory clinics can provide, appropriate sensitivity to different needs, different cultural needs and preferences. So they really are the hub in terms of navigating to appropriate care and to that support and guidance and so on. That's been really, really important. Again, they have evolved. They've not always been sort of that, that kind of that model. when I first started on the National Dementia Strategy, I was also working on an early phase, this is about 10, 15 years ago, of our innovation hub. And Louise Robinson and I, who we were developing it, she's a GP, and we were shocked that each GP surgery had a different database. And there was no easy way to share data between the hospital, the GP, and an online service. There was equally no way that the GP could know in their area of what voluntary services were available. And as a carer, I remember being genuinely shocked by that. But it's life, and it happens the world over. That the left hand doesn't talk to the right hand, and sometimes just the simple thing of just trying to connect it together. It's not easy. It's not it's not plain sailing, but at least following years of work, we've been able to map in each region where the voluntary services support. So if someone came along, it's not always the hospital services. It can be something as saying, this person loves singing, he loves music. And actually, if there was a Singing for Health group in this area, I would love to know about it. And then being able to kind of navigate to it. Then we've got all the complexity of who pays, but that's almost, the next day's job. But what's important is that we can find the good services. And again, I don't know if Singapore is the same, but the UK, we have different regions, different postcodes, and it can be a bit of a postcode lottery as to what you're able to access. But the bottom line for us is that people knew about it, and then we could kind of help to kind of access them the services that they want. Over the last couple of years, we've seen that a lot of join up of memory services. So again, in the ethos about what works and being able to share that and accelerate that. So there's been accreditation programs that have come through. The Royal College of Psychiatrists, for example, has a memory service national accreditation program, which again really encourages collaboration and sharing of best practices between clinics, and that real push to evidence what works and to ensure that evidence is updated and that any dementia guidelines that follow are kind of linked to that. So again, bringing together that research, all of those wonderful kind of cutting-edge therapies, etc. Let's make sure that people have access to them at the earliest possible opportunity. Again, cross-clinic networking, being able to look at different regions, what's working, what works in different protocols, best practice. The idea is if something is working, we want to know and we want to accelerate it as quickly as possible. And so I know that Oxford, for example, their dementia clinical network facilitated a lot of different cross-clinic visits and a lot of mutual support for these programs, which is making a difference. And then, as in Singapore and others, the big seismic shift has come for dementia care in the UK from the development of integrated care systems. They're relatively new, but actually this principle about connecting different parts of the health and care system, including memory clinics, is really, really important. And being able to support the sharing of learning and good practices across different geographical areas and between regions is really, really important. And again, from the professional point of view, this is kind of almost a paper exercise, but if you are caring for someone with dementia, back to that again, it really makes the difference that you're able to access that support. And so the integrated care systems has made a massive difference in order for the person with dementia and their family. They don't need to know. It's a bit like a swan. They just need the smooth surface of how to access the support. And the fact that underneath the surface of the water, there's all sorts of activity going on and joining up different budgets and so on, that should be irrelevant to the family. What they should have is that one-stop shop, being able to coordinate care. And when you're in the middle of a crisis and you're in the middle of caring, the last thing you need to do is to be faced with the complexity of having to do a lot of this work yourself. So if the care services can take away some of that challenge and really, really help people to connect, that's got to be the ultimate goal. So, the memory clinics, in terms of their best practices and their impact, have been around really helping people to have the early diagnosis, very, very rapid technology adoption wherever possible, and then as much as we can, sort of really comprehensive post-diagnosis support, and also integrating research in. So there's a lot of C's. It's kind of community, it's care, it's carers, it's coordination. But increasingly, it's about collaboration, working together, and then creativity and curiosity, because, again, carers have got so much knowledge, insight, wisdom, insight into what's needed, and then we can match that with what's possible. So all the time, walking the walk with carers and families to really understand is a big part of what we need to do in dementia care. There are challenges. We are developing these in the UK. I've seen huge step changes over the last 5 years and the last decades, but resource is constantly an issue. And I think these are some of the future challenges in terms of the access. I mean, there is still great inequality in terms of access. That's something that is a constant across all health services. People in deprived areas experience longer waiting times for diagnosis still, and of course, as more and more people want a brain scan and so on, that's sort of contributing to greater waiting lists. And so, but that's across all service systems, and something we need to be looking at. Again, there's kind of sometimes limited health assessments. So, for example, there's not consistency in terms of, for example, hearing and eye checks that are provided, that might be provided through a different part of the system. But again, once we know that, and this is where the data is so important, we can work on that. And then involvement in research, I obviously there's a little bit of a, she would say that, being a researcher by background, but it is so important to bring forward the new treatments that can really, really make a difference. And given that dementia has been for so long the poor relation of research and clinical activity, I think it's quite right that we put the spotlight on investing in research and bringing forward the brightest minds to address perhaps what is one of the greatest challenges. So that's really, really important. And then all the time, as in Singapore, this post-diagnosis care, it's fine to get a diagnosis, but you have to have the support and guidance to lean on following that. And so, making sure that there's a lot of proactive planning, very skilled coordination from very knowledgeable professionals who can help navigate through the journey with dementia to the right care and support is just so important. And we really do kind of put quite big emphasis on that. Again, I'm coming from an innovation perspective. What I mean there by innovation is, what can we do differently? How can we improve? Innovation is not just about magic new technology and gadgets. Innovation is just, what can we do differently? How can we do this better? And so again, from an innovation perspective, we're all the time looking for the gaps in innovation so that we can better fill them. And again, we're looking at kind of better diagnosis and process, but particularly around this issue of navigation to the right support. Even as somebody who's worked in dementia for 30 years, and I know a thing or two about it, thankfully, when it came to me and to my uncle who was living with dementia, I found I was just like the next person. I didn't know quite where to start to find the right support and guidance. So if I can't find it, what is that like for somebody who is very, very fresh to this and really doesn't know? So again, building everything around making it as easy as possible to understand what's happening and to be able to navigate to the right support at the right time remains the most important thing. When I first started in dementia care as well, we used to say that if you've met a person with dementia, you've met one person with dementia, because everybody's experience is different. And that, for me, remains one of the truest things today, that what I experience is not what you might experience. My family is different to your family. As people get older, they get more kind of unique, if you like. We've got longer to develop our preferences. And some of those change with dementia, but some of them remain the same. And it can be really confusing to understand that. So again, investing in personal and tailored guidance and support to really understand what that family is experiencing and what is right for them at the time is perhaps the priority in terms of, not just being able to find it, but sometimes it needs actually developing. And it can make a transformational difference. I'll never forget a time when I was, again, very, very young, and I went into a nursing home, and there was a lady there. She was called Edith, and she was sitting hunched up in a ball. She wasn't making eye contact with anybody, and I was in the home for about 3 weeks, and I didn't see Edith interact with anybody at all in that time. Even at meal times, she was hunched up, looking down, didn't speak. There was no emotion there. And then all of a sudden, one day, a man walked in, and do you have one-man bands? So this was a man, he had an accordion, he had cymbals between his knees, he had a mouth organ, and he came in making a lot of noise. I just watched Edith unfurl. In 5 minutes, she was joining in, she was flirting, she was doing all the actions, there was eye contact, amazing transformation. Just from being able to engage with that music. There was music all the time in the setting, but it was just that one interaction, and what a difference it made. And then for that kind of 15 minutes, Edith was alive, and you saw that kind of person come alive again, and that's what we've got to be looking for. And one of the frustrating things for carers is that sometimes you just don't know what to do. You become at the end of your tether because you've tried everything, but you're not getting any reaction. And again, this is where we've got a journey to do. There's no fixes quite yet, but we're getting better and better as a global community of carers, of researchers, professionals, whereby we might be able to just unlock what that person is experiencing and make such a difference to that person's quality of life and to their well-being. So, even so, you can go for days and days and weeks where you don't feel you're making any progress and you don't feel there's any kind of flash of insight. All of a sudden, you don't know what it might be, but then you get that kind of hook and that interest. And, that's what we've got to try and bring forward, some of those magical moments. I'm not for a minute suggesting that we have an army of one-man bands. But, just in terms of just understanding what that person's experiencing is just so magical. Again, technology is just making a difference. It's not the answer. I think we need more and more people, because I think as humans, just that connection is what we need more of. There was a shocking statistic from the UK about a decade ago that a person in long-term care in a nursing home had as little as 5 minutes interaction with another human being in that time. So isn't that shocking that the most vulnerable people in our society have so little interaction? And again, we've got to address that. So again, looking at volunteers, looking at how we can mobilize our communities, people to come together to just have that time together. And this is true of dementia, but it's true across the board. No matter what you're experiencing, coming together as that connection is just so important. And so technology has a role, but in terms of actually supporting quality of life, I think there's so much else that we can do just to connect as human beings together, the most vulnerable people in society. And dementia just puts a lens on that. It puts a lens on what's important to connect and how to care. Then just in summary, really, just some final kind of slides in terms of, perhaps this is something that we can kind of, take time just to have a little discussion in kind of with the people around us. But what drives us is kind of the innovation that's needed. Okay, we've got some certain things in the pipeline. We've got some wonderful research coming through. We've got new technologies and so on, but where are the gaps and what are the priorities for us? What do we want to understand that perhaps we don't? What would we like to see more of? What do we value? What do we care about? What are our aspirations? Because so much of this is not just about, we've got to raise the bar. I want to hear what do you aspire to have? What does wonderful look like? And actually just by thinking about understanding a day in our shoes, that's the way we often do it with kind kind of the groups that we work with through Voice, just so that we can understand how might a person with dementia and their carers be experiencing the world differently. You know, what strengths and abilities can someone retain? Because so much of this conversation is often about what people have lost, but actually flipping that to the glass half full to say, actually, what's still there? What can we really power and play to is really, really important. And then, you know, how can we actually use innovation to perhaps look at supporting a conversation of someone who's having difficulty word finding? And again, just bringing, again, the experience of somebody who's lived through that is just so important in helping us to know kind of both what to do and perhaps what not to do as importantly. In you know, in the groups as well, you know, I've mentioned a number of times just how important it is to kind of walk the walk of the family caregivers and professional caregivers as well, of course. But I think for family members, it's particularly real. And again, you know, there's a lot of kind of safety concerns that people have, but there's also a lot of ethical dilemmas arrive. We did a lot of work about 15 years ago on risk, because actually we had a lady, she was called Flora, who lived in one of our communities, and her husband had Alzheimer's, and he wandered a lot. He used to go off for walks, and she taped into his jacket his name, address, with a note to say, if found, please bring back here. And that caused absolute outrage between her family, her friends, the local police. But actually, what are the ethical dilemmas? If he really was enjoying walking, if we could understand if this was a good thing, what are the pros and cons? And so again, a lot of this decision is not about restricting people. What about opening up the opportunities to continue to run, to pursue hobbies and interests, you know, whatever you want to do? Because the risk is that people with dementia's lives just become more and more constrained and shorter, and actually we may be doing a huge disservice and just being able to open up those opportunities. So those ethical dilemmas are really, really important. And then again, you know, I mentioned about respite care. I'd really love to know your views on this, because caring is exhausting. It's 24 hours a day, it's 7 days a week, often for many, many years. And so how we actually support people to have a break, I think, is really, really important. And of course makes the difference between someone being able to continue to care at home and perhaps, you know, not being able to continue. So I think we've got to really be imaginative about different kind of care models that we come up with. And then again, you know, designing dementia-friendly space, because I think, you know, we've done this at quite a basic level to start with. As I said, there's some really important work around signage and so on. But, you know, what else could we do to help that person kind of minimise any anxiety? What could we do to kind of prevent a lot of the accidents that can occur? And then, you know, in terms of kind of the monitoring and so on, there's so much more that's possible there. And in terms of communication, I think this is an area that's you know, really close to my heart in terms of, you know, thinking through to the one-man band again. It's how you actually understand what that person is experiencing and don't second guess it, because I think as carers we often kind of just almost put words into people's mouths and we kind of assume that we know what's happening. But how can we use technology to really inform that? And some of these are at the boundaries of what we know, but I think that's an area where even if we haven't yet got the technology and solution, if we have the right questions, we can mobilize this amazing you know, global community to kind of to help to find them. So that was a very, very quick run through just some of what we feel are some of the key policy areas and the key issues for caring with our family members with dementia. As I said, I come from this from long experience of research, but also from a carer myself and also as a trustee of a big charity. So I think there are few things more important than getting care and support right for people with dementia, the most vulnerable people in our society, an ever-growing group of people. But I'm really hopeful and optimistic that together we can develop more and more solutions. But we need our policymakers, we need our funders to continue to invest in this. And I think that's going to be really, really important. But what I wanted to do now is just to pause and say, are there any quick questions? I'm more than happy to take them. But then, you know, chance to just kind of in our our kind of seats, and for the people online, I think it's a case of putting things into the chat. But just to kind of take some time just to reflect on some of the issues that I've raised today, but also from your experience, and think through this issue of kind of in terms of innovation, what do we think are the gaps and what are our priorities? And I think if we can kind of think through some of that, I think that will be a massive help that we, colleagues in the room, colleagues that are linked to kind of here in Singapore and internationally, that we can take forward from this. So quick pause for any questions immediately.